Hi, Dr. Kevin Leizer.
Hi, Sevgen. Yeah, nice to see you again.
Nice to see you too. So, what we're going to talk about today?
We're going to talk about the knee today. As you know about Nura, that she's had a knee problem, and I just wanted to address some of the problems she has. And also, most of my patients will know me, and we do specialize and do a lot of treatment for the back, the neck, the spine. You know, back problems, neck problems, leg problems. But another problem that we treat a lot is the knee, and we do a lot of knee problems at various ages, even children and younger adults, all the way up to obviously older people as well. Knee problems are very common amongst all age groups as well.
She's 86 years old, and then she's got these problems since 1979.
Yeah.
She just told us.
Yeah, that's amazing. I mean, unfortunately, it's one that doesn't get recognized very well within the healthcare system because people tolerate it. The GPs are, as you may know, because since COVID, are under a lot of pressure, and knee problems kind of move to the back of the list because there's other more serious conditions, unfortunately, that and there just isn't enough time or even finances to be able to deal with other problems, which, knee problems are not going to kill anyone, obviously, but it's still something that makes life very uncomfortable for a lot of people. But we deal with knee problems, always have done, in addition to the other problems that we treat. And I just wanted to explain a little bit more about more common knee problems that we see all the time. Yeah. So in Nuria's case, for example, she has a very common condition known as bursitis, okay? And what it is very simply, on the kneecap, if this is the front of the knee here, as you can see, and this is the kneecap, the front of the knee, and behind the bone that is in the front, there's a space there. And the bursa is just a pad that's just there to protect it as a bit of shock absorbing. And it really is just a little bit of almost like water behind here, which is fine and it works normal in most patients. But obviously when someone has a knee problem, quite often that area can become inflamed. And with that area of inflammation, we can treat that quite easily with a series of ultrasound, some electrotherapy, some mobilization and manipulation, some massage. And usually in quite a reasonable amount of time, maybe a few weeks, in a relatively short period of time, we can resolve the pain, get rid of the inflammation, and the patient can, and even 86 years old, can recover very quickly and resume back to normal life without any pain, which is quite nice. I have to say, she may be 86, but she's not the oldest one. I just was treating another patient who's nearly 99. So, so age is no bearing in terms of the treatment. The treatment we do is perfectly safe and fine for patients of all ages. We treat babies and all the way up to 100. From 0 to 100 we treat. Yeah. The other common knee problems quite often associated with muscles. So we don't see a lot of patients that actually have problems in the knee joint, in the cartilage, although that does happen with some cases. And in case if a patient has a knee injury where they've torn the cartilage, for example, quite easily we can arrange an MRI scan, sometimes even the same day or the next day. And is sometimes the case, we might have to arrange for injections, and we can arrange that, and we do injections here as well too. So whatever the situation is with respect to the knee, if it's a muscular problem and where the muscle's attached to the side, again, that's something similar to what Nuria has, where we can treat that again with ultrasound, electrotherapy, mobilization. So most knee problems are quite simple in nature to treat, and within a relatively short period of time of maybe 3, 4, 5 weeks sometimes, we can usually resolve most of these problems and patients resume a normal life without any problems. So what I'd like to stress to patients is more than spines, we do knees, we treat the shoulder, we treat feet problems. So I'd like to think of someone like myself, a chiropractor, of dealing with more than just spine problems. We do a lot of work on the back and the neck, but we also do the other joints, the knees, the ankles, the feet, the shoulders, elbows, wrists. But I just want people to be more aware about the knees, for example. So if you know anyone, everyone seems to have an older auntie or their mother or their grandmother that complain about knee pain, bring them in, because I'm sure there's a lot we can do to help them. And if we can't, then we can definitely get in MRI scans, arrange injections. There's a lot we can offer these people that they can resolve these problems and lead a more comfortable life. Yeah.
Very good. Thank you very much then.
My pleasure. Nice to see you again. All right. Thank you.